Hello everyone. Today my topic is Parkinsonism and this is under the subject of physiotherapy in neurological conditions. So Parkinsonism or Parkinsonian syndrome is a group of disorders which manifests as tremor. So tremor is usually the involuntary movement in the body or its parts. Disturbances in voluntary movement which can be featured as bradykinesia, rigidity or akinesia, and impairment in the balance, gait and coordination of an individual. And the most common type of Parkinsonism or Parkinsonian syndrome is Parkinson's disease, which usually is a very common term. Now when you talk about the clinical features of Parkinsonism, the first three are bradykinesia, rigidity and tremor. And these three features are said to be the cardinal features of Parkinsonism. So let us know about these three features. Number one is bradykinesia. So bradykinesia is basically slowing of movement with decrease in the amplitude and intensity of contraction. So here in bradykinesia, the movement time and the reaction time of an individual is also increased. So usually the patient is being manifested as very lethargic or very lazy in doing the movements, and the patient is very slow in doing each and every movement or even doing his activities of daily living. So if it's a very in the very later stage, the patient develops bradykinesia to a very severe extent. The next is number two, that is rigidity. So rigidity is basically an increased in the muscle tone, which is manifested as co-contraction of agonist and the antagonist muscles. So usually we have two types of rigidity. One is cogwheel, which is usually manifested as intermittent, and the other is leg type rigidity, which is a very uniform one. So in Parkinsonism, rigidity can be either of leg type or it might also be of cogwheel type. Next is tremor, which is the third cardinal feature of Parkinsonism. So when we talk about tremor, it is usually involuntary oscillations of body parts, and in tremor can either be of resting tremor or of intentional tremor. In Parkinsonism, usually resting tremor is seen, and as per their pattern, tremor can be of pin rolling type or of drum beating type, and in Parkinsonism usually tremor is seen to be of pin rolling type. So these three, bradykinesia, rigidity and tremor, are the three cardinal features of Parkinsonism. A patient to be diagnosed with Parkinsonism has to have these three features for sure. Next is postural disturbances. So the posture of an individual is usually disturbed in a very late stage, and the patient is seen to develop a kyphotic or a scoliotic posture. Next is gait. So the typical gait of Parkinsonism is a fascinating gait. The patient is have very short shuffling steps while the patient walks, and the gait is usually of another type, that is freezing gait, where the patient is unable to initiate a movement, or maybe when a patient walks, the patient is unable to give the first step, that is known as a heel strike. Or even if the patient is being instructed to just move suddenly or rotate suddenly, the patient will be unable to do that. Or even at times the patient is unable to stop a movement where it is being done. So stopping of movement, initiating of movement becomes very problematic for a patient of Parkinson's disease. Now next we talk about facial attitude. When you talk about facial attitude, the patients usually have expressionless face. They do not have much expressions on their face, and they keep on staring at individuals, and their blinking is also reduced. And we have another feature, that is drooling of saliva. There is increased salivation and the saliva keeps on drooling from the corner of the lip. Next is speech. The speech is usually slurred speech. About visual difficulties, there is the next point. Usually blurred vision is seen, and the blinking response is reduced. And very rarely you can see diplopia in Parkinsonism. Talking about imbalance and coordination, so the patient becomes imbalanced both in the static form and in the dynamic form. The assessment is done as per the balance test, the Romberg's test, the Chopin-Romberg's test, the get up and go test, the timed up test, the one leg stance test, and we can also test the coordination. We can assess the coordination with the help of non-equilibrium and equilibrium coordination tests. So we can see both the balance and coordination are being impaired in a Parkinsonism patient, and they have a large tendency to fall more often. And the most important point is psychological impairment. So the patient has moral low down. The patient also has lack of confidence the patient feels socially neglected, and at a later stage, a Parkinsonism patient also develops dementia. So these are the clinical features of a Parkinsonism patient. And in my next class, we should talk about the PT management or the physiotherapeutic management of Parkinsonism. Thank you.